Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, you'll be able to help support our community here at DemiRx Care. So what is our medication of choice today? Our medication of choice is called Imodium, and the generic name for that is called Loperamide. So this medication is used to treat diarrhea in patients who are having, diarrhea symptoms. And the way this medication works is it increases contraction in the stomach area. And by doing this, it reduces the movement of the intestines in order to be getting rid of stools. So it does this by reducing movement, as I said earlier, and helps reduce the movement of stools towards the anal area where you actually feel the urge of using the bathroom. So this medication comes in a caplet, and it also comes in liquid form as well. So for the liquid form, it comes as a 1 milligram / 7.5 ml liquid, as well as a 2 milligram caplets. So in adults, this medication is taken as a 2 caplets after the first initial bowel movement. And then after that, then you want to take 1 caplet after the next loose stool. And the maximum amount of caplet that you want to take in this patient is 4 caplets. So like I said, 2 caplets after the very first initial bowel movement, and then you take 1 caplet for every stool after that. So if you are taking the liquid, so you take 4 teaspoons after the first initial bowel movement, and then you take 2 teaspoons after the next bowel movement. And like I said, the maximum for the caplet is 4 caplets, and then the maximum for the teaspoon or in terms of teaspoon or the liquid will be 8 teaspoons. So for patients who are aged 9 to 11 years old, then you want to take 2 teaspoons of the liquid after the first initial bowel movement, and then you take 1 teaspoon after the next bowel movement. And the maximum for patients who are 9 to 11 is 6 teaspoons a day. So for patients who are aged 6 to 8 years old, you want to take 2 teaspoons after the very first initial bowel movement, and then you take 1 teaspoon after that bowel movement. And the maximum for patients 6 to 8 would be 4 teaspoons a day. So what are the side effects of Loperamide or Imodium? So side effects include constipation. So if you take it more than you're supposed to, then you're getting the opposite of diarrhea, which is constipation. It can cause dry mouth as well as abdominal cramping. It can also make some patients feel nauseous, as well as cause drowsiness and vomiting in patients. So this is a medication that you don't want to use for more than 2 days unless you're directed to do so by your doctor. Also, you don't want to use this medication if you're having a high fever in addition to the diarrhea, or you're having a bloody stool. So there might be additional diagnosis or screening that the doctor needs to do in terms of bloody stool or high fever in addition to the diarrhea symptom that the patient is having. Also, you want to make sure that you're drinking plenty of fluids at this time in order to avoid dehydration. So you want to avoid dairy products such as milk when you're having the symptoms in order to avoid, continuous diarrhea. Also, you want to avoid foods such as alcohol, spicy food, or caffeine during this period in order to help reduce that symptom. Also, in patients who have this diarrhea, if you're having diarrhea for more than 5 days, then you want to make sure that you're reaching out to your physician in order to see if there's any other additional condition that your body might, not be taking well, that the doctor also wants to screen for. That way, you're not just taking the medication and it's not working, and the condition that's causing that diarrhea is worsening, as time goes on. All right, I hope you really enjoyed this video and I was able to help in terms of what to look out for and how to take Imodium properly. If you have any questions or concerns, be sure to insert a comment down below. Also, in order to reach out to or consult with some of our pharmacists, you can go onto our website at www.damiarxcare.com in order to talk to a pharmacist about other medications that you're taking, as well as if you have other conditions that you're worried about while taking this medication. All right, thank you for watching and stay blessed.